Sleep assessment and sleep health in nursing practice. Sleep is a vital biological requirement and a key indicator of overall health. In this mini-learning module, we will explore how nurses assess sleep patterns, identify sleep health concerns, screen for common sleep disorders, and document findings to support holistic, patient-centered care. Sleep health goes beyond the number of hours slept. Poor sleep quality, irregular schedules, and untreated sleep disorders increase the risk for cardiovascular disease, diabetes, obesity, depression, anxiety, and accidents. Nurses often serve as the first point of contact and play a critical role in recognizing sleep-related concerns. Sleep is regulated by two interacting systems. The homeostatic process builds sleep pressure the longer we stay awake. The circadian rhythm, controlled by the brain's internal clock, regulates sleep timing. Light exposure, exercise, diet, and social routines all influence this cycle. Sleep occurs in cycles of non-rapid eye movement, or NREM sleep, and rapid eye movement, or REM sleep. NREM sleep supports physical restoration and immune function, while REM sleep supports memory, mood regulation, and cognitive performance. Each sleep cycle lasts about 90 minutes. Sleep health is multidimensional. Nurses can use the RU-SATED framework to guide assessment. RU-SATED stands for regularity, satisfaction, alertness, timing, efficiency, and duration. These 6 dimensions help identify sleep problems quickly and systematically. Regularity. Do you go to bed and wake up at consistent times? Satisfaction. Do you feel refreshed when you wake up? Alertness. Do you stay awake during the day without dozing? Timing. Are you asleep during typical nighttime hours? Efficiency. Do you fall asleep within 10 to 20 minutes and stay asleep? Duration. Do you get 7 to 9 hours of sleep, depending on age? Simple questions like, "How is your sleep?" can uncover significant concerns. A focused sleep assessment includes asking about sleep patterns, total sleep time, sleep quality, daytime fatigue, and the use of sleep aids such as alcohol or medications. Environmental and lifestyle factors such as shift work, stress, caffeine, and screen use should also be assessed. When concerns are identified, nurses can screen for common sleep disorders. Obstructive sleep apnea may involve snoring and daytime sleepiness, and can be screened using tools such as stop bang. Insomnia involves difficulty falling or staying asleep. Circadian rhythm sleep disorders occur when sleep timing does not align with work or social demands. Accurate documentation is essential. Nurses should document sleep duration, sleep quality, contributing factors, daytime symptoms, screening results, and referrals when indicated. Clear documentation supports continuity of care and clinical decision-making. Sleep diaries allow patients to track sleep patterns over time. Polysomnography is a non-invasive sleep study that monitors brain activity, breathing, oxygen levels, and muscle movement to diagnose sleep disorders. Nurses educate patients on healthy sleep habits, encourage consistent sleep schedules. Tailoring light exposure to sleep-wake preference can help regulate circadian rhythm. Sleep hygiene education. The ideal room temperature for sleep can vary from person to person. Generally, an ideal temperature is between 60 degrees and 77 degrees. Minimize noise levels and use earplugs if necessary. A good mattress and pillow can improve sleep quality. The bed should only be used for sleep and sex. Keep the bedroom as dark as possible. Wear an eye mask if needed. Avoid caffeine 8 to 10 hours before bed. Avoid alcohol before bed, as it may cause restless sleep. Avoid heavy meals before bedtime. Exercise regularly in the morning or afternoon. Avoid exercise close to bedtime. Avoid screen time at least 1 hour before bed, or ideally 2 to 3 hours before. Avoid cool-toned blue-green lighting around bedtime. Use warm-toned red-orange lighting instead. Sleep disturbances are closely linked to mental health conditions and can provide important diagnostic clues. In depression, individuals may experience hypersomnia, sleeping excessively, yet still feeling fatigued. During bipolar disorder, especially in manic or hypomanic episodes, sleep needs are often significantly reduced, with individuals reporting little to no sleep without feeling tired. In schizophrenia, sleep patterns are often irregular or fragmented, and some individuals may experience increased sleep related to medication side effects. Recognizing these patterns helps nurses identify changes in mental status and guide appropriate interventions. Sleep assessment is a core nursing skill that supports patient safety, recovery, and quality of life. Nurses play a critical role in screening for sleep disorders through structured assessments and validated screening tools. By identifying sleep concerns early, nurses can provide patient education and implement effective interventions to promote and improve sleep.